Welcome, everyone, to Totally Preventable podcast. I'm here with Dr. Philip Chan, MDMS, Consultant Medical Director for the Rhode Island Department of Health, Division of Emergency Preparedness and Infectious Disease. Welcome to Totally Preventable.
Thank you so much for having me.
Anytime. And I wanted to add that we could probably be talking to you about numerous things, but today we have you on for some information on the You Good Man campaign through Rhode Island Department of Health. Can you tell us a little bit about that campaign?
Yeah, thank you, Polly, so much for having me. So we're very excited about this campaign. This campaign is called You Good Man. It was developed here at the Rhode Island Department of Health. I want to give a shout out to all my health department colleagues on this one. And the goal of it is to really focus on making guys specifically more comfortable talking about mental health. There's a culture, especially in the male side of things, where you don't talk about your mental health, and you always have to appear as a tough guy, and it's not cool to talk about your feelings. And so the goal of this campaign was really to try to create an atmosphere and try to create a setting where guys are more comfortable just opening up and talking about their feelings, especially when they're in trouble, especially when they're in need of help.
We've seen some of the social media posts that are maybe in a toolkit or something that you've shared us, and they're great. They're very laid back and very normal. They show you normal looking people doing normal things. It's not clinical. It's very nice. It's great. Can you share some data around men's mental health in Rhode Island?
Yeah, and one thing as a physician is that I've learned that, everyone struggles from time to time. And, I think of life as, normal to have ups and downs. And, for guys at least, as I mentioned, sometimes it's really tough for guys to ask for help. And, when you look at the state of Rhode Island and really across the country, guys are really more likely to, for example, die from suicide.
Mhm.
So our suicide prevention team was really one of the creators of this campaign. When you look at the state of Rhode Island, we have over 100 suicides a year here in our state. It's been consistent over time, and guys are more likely, twice as likely to die of suicide than women. So that was part of the campaign, was just to raise awareness about this issue. The guys that we do see who do tend to commit suicide tend to be a little bit older, in their 20s, 30s, 40s. So it tends to be middle age and a little bit older. Uh, and to me, it's also a sign as guys age, sometimes social connections become a matter. I think we saw this during the pandemic. We know how important it is to be social, to be connected. And I think for a lot of guys, especially as life progresses here, sometimes you get married, you have kids, you got work. Sometimes it's normal, especially for guys as they age, to be less social, to be a little bit more isolated. And that can lead to certain mental health conditions, depression, anxiety. We also know that guys are more likely to use drugs, potentially overdose. So all these things are related. And again, this campaign was just meant to open a conversation for guys, especially to start talking about their mental health, to try to normalize it, so that we can have these conversations.
Great. Can you tell us some options that men in Rhode Island have if they're struggling and they want to reach out to somebody? What are some options that they have?
Yeah, so great question, Polly. And the way I think about this is twofold. I think in general, for everyone, not just men, but especially for men, in this podcast, is to recommend just fostering and working on friendships and relationships. I think it's important that if you are feeling down or you're feeling like you need help, is to talk to someone, and that can be a good friend, it can be a family member, just about what you may be experiencing. And I think it's important for people in general to connect and share some of those emotions. For guys that are really struggling and that feel like they may have hit their limit or even feel like you're getting to your limit, and that's one thing that I counsel my patients on is you don't want to wait until you are totally down in the ditch, right? You want to ask for help if you feel like you're getting down or too down. You don't want to wait till you're, down to the point of where, everything feels hopeless. I do encourage people to reach out and start with their primary care provider. There's a lot of guys out there that don't have a primary care provider. I would recommend certainly for guys to get a primary care provider or at least someone in the healthcare world that you can talk to, not just about mental health, but frankly, physical health and other things. And certainly for folks who may start to feel suicidal or totally hopeless, that is really, really a warning sign in the mental health field. And, there's the 988 Suicide and Crisis Lifeline that's available 24/7, 365 days a year. You can call or text and chat with a trained counselor. So 988 is that Suicide and Crisis Lifeline. That's a good safety net emergency connection there. And then here in the state of Rhode Island, my colleagues at BHDDH, under the leadership of Director Leclerc and others, Linda Mahoney, have really been working to strengthen our network of behavioral health clinics. And so there's a new initiative here in the state of Rhode Island called the CCBHCs, Certified Community Behavioral Health Clinics. And these are a network of community health clinics across the state, across every community, whose goal is to really provide mental health care to any Rhode Islander who needs it, regardless of the ability to pay. So we've worked hard here in our state to get a network of clinics and to improve mental health resources. I understand that is not enough, that oftentimes there's trouble getting in. But we're working our best to try to strengthen that system. The Department of Health, BHDDH, Executive Office of Health and Human Services. And at the end of the day, I just, use your primary care providers, that entry point for a lot of these issues. And primary care providers, all of us are trained to really do what we can to help people.
Excellent. Are there signs that maybe friends and family of a loved one, in this case, a man, should look for and know to help them know when to reach out and provide a little extra support?
I think the big things are when people are struggling, when people express feelings of sadness or being depressed about something. And I think part of that's normal. Certainly, if people have stressors or bad experiences in life, or someone dies. I think the real warning signs are when those feelings start to affect one's life. And so that could be in the form of isolation. It could be in the form of calling to work sick routinely, isolating, not wanting to go out, talking about wanting to die is a big one, feeling guilt or shame, and just really being isolated and not wanting to be around people. Those are all really big warning signs. And certainly someone expresses suicide and tells you like, look, I think I want to die. I think I'm going to kill myself. And certainly if they start talking about a plan, that's when you yourself should really engage the medical system and just get that person help. And also just be there uh, and encourage them to get help as well.
Are there best practices to how a family member or friend could get somebody some help, especially if they were unwilling?
I think the first thing is just to be there and to be willing to listen, to let the person know that you are willing to listen, that you're happy to help as you can, and to keep encouraging and to be affirming. I think we have a lot of good resources in this campaign. I do encourage folks to go to the website to check that out. But I think the first step is just being available, talking through some of the issues, being supportive, being a supportive friend or family member, but also recognizing those warning signs and encouraging folks that if there are some of those warning signs to really engage with the healthcare community and finding a trusted person in the community, like a primary care provider, that the person can talk to, engage with to start to talk about this. And I do have a lot of folks in my own practice who are either brought in by someone or come in with someone. And I think offering to come in with them can be a good approach as well.
Excellent. Is there anything about the initiative that I didn't ask that you wish to share?
So the website is yougoodman.org. And again, just for folks that may be listening, mental health, behavioral health is really an important health topic. A lot of times we focus on, one's physical health. It's, get your blood pressure under control, diabetes, cholesterol. But mental health is so, so important. And I think sometimes, especially for guys, it gets it gets, put in the corner. But really, just, as part of this campaign, we wanted to highlight the fact that it is okay to talk about this, that everyone needs help from time to time at different points in their life. And this is normal and it's okay. And sometimes it's tougher to ask for help than it is to just suck it up. And so many times, among my patients, even in my personal network, there's just this hesitation to talk about these issues. So just want to really encourage people to, to get connected to primary care, especially to find someone that you trust in the healthcare setting that you can talk about these things. And don't be afraid and don't be hesitant to talk about these. Even as a primary care physician, I had these conversations every single day of my career. It's normal. And a lot of times I just spend times talking through it. And sure, I off medications, but I'm never going to force people to do anything they don't want to do. And a lot of times I'm just there to listen. Sometimes I connect people to counseling. Sometimes I do prescribe medications. But it's really that discussion with people in terms of what they want to do, what they feel comfortable with. But the first, the beginning step is just to find someone, a healthcare provider that you feel comfortable talking to, so you can make that connection and you can talk about these topics.
Excellent. Thank you for sharing this information with us. We've been very excited about the You Good Man campaign, although I have called it like You Good Dude, and I have butchered it a little bit, but You Good Man.
You
Thank
good man.
you,
Yes.
good man. Thank you so much for joining us and sharing this information with us. We appreciate it.
Thank you, Polly.